Erythema and vascular concerns are common among cosmetic patients, but many practices struggle to find the best treatment options. So what really works? In this edition of Cutera Experts Corner, Dr. Jeffrey Dover of Chestnut Hill, Massachusetts, outside of Boston, leads a lively discussion about this common complaint and the potential role for Cutera's Excel V Plus laser.
I'm co-director of Skincare Physicians, which is a big dermatology group that covers everything from pediatrics to geriatrics. And I do mostly aesthetic procedures, a lot of energy-based and light-based treatments, a lot of fillers and toxins and aesthetic procedures.
Dr. Dover was joined by Dr. Mary Lupo of New Orleans.
I am clinical professor of dermatology at Tulane and founding co-director of the Cosmetic Bootcamp, and I am not a laser guru.
And Dr. Vic Ross, director of the Laser and Cosmetic Dermatology Unit at Scripps Clinic in San Diego.
We're a big multi-specialty group, and my focus is on cosmetic and laser dermatology, medical, and some medical dermatology, but it's all laser-based or energy-based.
Dr. Dover kicked off the discussion with a question for the panel's fourth member, Dr. Omar Ibrahimi.
I am in private practice in Connecticut, and my practice focuses on a mix of skin cancer, Mohs surgery, and laser and aesthetic procedures.
Omar, is vascular big in your practice? Do you treat a lot of things that are red?
Yeah, I think for any dermatologist, whether they're medical or aesthetic, vascular is often one of the biggest presenting complaints of patients. So where I practice, rosacea is probably about 15% of the visits and complaints, and having a laser like the XLV Plus is wonderful because our medical therapies and options are often not adequate to control their condition.
So are you saying that 15% of all the patients you see or the procedures you do are for red faces?
I think 15% of patients that are coming in for medical dermatology concerns tend to be vascular related issues, and the most common of which is rosacea.
That's remarkable. Mary, how about you?
So I have a large aesthetic population. 90% of what I do is aesthetics and mostly injection-based. But I obviously have to have very good laser equipment to complement my injection skills. And, I see a lot of what I would classify as dyschromia. And a lot of people do realize that it really doesn't matter what you do with an injectable. If the canvas of the face is blotchy and mottled and dull, it's often not appreciated. So using skincare and devices to improve the quality of the skin is very important in my practice. And yes, it's red and it's brown, but the red is usually the rosacea patients and the profoundly photodamaged that are skin types 1 and 2. And what I really like is that patients do understand that there is a medical aspect to their skin conditions and there's an aesthetic aspect to their skin conditions. And we treat them with medications, get everything under control, and then we go to the energy-based devices. And XLV Plus is a favorite because of the variety of conditions that we can treat. And dare I say, I can use it in more skin types than I can with many other devices. I have no problem using this in a skin type 4, where there are other devices I would be less likely to use them. So I think the versatility of the machine in my practice is that I have an aesthetic practice, but the medical patients that I see often convert to, if you will, cosmetic patients because of this device.
Mary, thank you. Vic, you've been involved in laser development since really the inception of lasers in dermatology. Tell us a bit about what's happened over the last 30 years in the vascular space specifically.
Well, if you go back to when I started in the early 90s, and of course the pulse dye laser really started the whole phenomena of lasers that were targeted for certain indications. But you look at the old pulse dye laser, it was slow, it caused purpura, you couldn't treat darker skin. I can remember treating even a type 4 patient, you were always perilously close to damaging the epidermis. And now we have these very elegant lasers, purpura-free, large spots, fast, cooling, which it's sort of odd that we didn't have cooling in the 80s. I know Barbara Gilchrist had an article, we put ice on the skin and Ken Arndt, but now we have these sophisticated integrated cooling devices. So we really revolutionized the vascular lasers from being primitive like the Flintstones more to a Jetsons-like, very elegant and reliable. Reliability was a problem before, too. You would turn the laser on and just hope it would work. So we've come a long way in 30 years.
Vic, thanks. Tell us about how the XLV Plus fits in now into this algorithm.
Well, the XLV Plus offers speed, reliability, comfort, and efficacy. And that's the four things that I look for. And the nice thing about it is the cooling is very, very superior to other devices. And what Dr. Lupo said earlier, I will agree with, is that you can actually treat type 4 skin, small vessels around the nose. And people would have said maybe 10, 15 years ago, you cannot treat vessels with a green light laser. But with the cooling of the XLV and the targeting and the real-time visibility, you can actually safely treat some darker skin. And you can cover large areas with the larger spot now. So there's a lot of capability in that device.
Vic, it reminds me of two things. One, we have 3 fellows every year, and they come in and they spend a lot of time trying to remember what device for what indication and what spot size and how to turn it on and off, and they have no idea what relics we used to work with. The original 532 had a 2 millimeter spot, no cooling, could barely see the spot, hurt like heck, blistered, scabbed, sometimes scarred, and now we've got this giant spot with unbelievable cooling. The device turns on, turns off, is quiet, plugs into 110, always starts, always works, almost never needs service, and they just don't know how much better what we have now is compared to what it was not that long ago. Would you agree?
I'd agree, yes. We've come a long way in a relatively short period of time.
It's amazing. Omar, tell us, you see so many vascular patients. How does the XLV Plus fit into a practice? Let's say I'm starting out in lasers and I want to get a vascular laser because it's 15% of your practice. Why XLV Plus?
That's a great question, Jeff. I think it's the XLV Plus, I tell people, is a great not only first laser for a dermatologist that's starting out, but even in a mature laser practice where I have 30 plus devices, it's a workhorse laser and one that is getting used every day. What I like about the device is, as you said, it kind of fires up easily, calibrates, you can adjust on the fly, you have the large spot size, and so treating patients that have rosacea or poikiloderma, these are things where even having the prior generation of the device, it took more time, and you had to use higher relative fluences because you had a smaller spot. Now with this 16 millimeter spot, you can actually come down on the fluence you're using. The cooling is actually enhanced so the patients are more comfortable. And as good as a laser physician I think I am, when I'm laying these spots down, I'm missing areas or creating skip areas, and having that larger spot means that I'm less likely to skip areas and create things. The other thing that I find really great about the laser, and this is something I think Vic will expound on, is we typecast it as a vascular laser, but at 532 nanometers, there's also a lot of melanin absorption. So, as Mary was also alluding to, this is a great laser, not just for vascular, but for pigment. So I think it's a no-brainer for a dermatologist to have.
So Vic, tell us, as Omar just asked, what sort of pigmented lesions do you treat with the XLV Plus?
Well, we typically, in San Diego, we have some patients who have exclusively red lesions, but I'd say 60% of our patients who have red also have brown. So we'll normally use the XLV Plus with a large spot and one pass go over the entire cheeks at the same settings that we use for vessels. And it turns out those settings will actually reduce the pigmentation quite a bit. And if we have to focus on discrete lesions that are so-called low contrast lesions, where the difference in the pigment is not so significant, we'll use the smaller spot and increase the settings a bit. The nice thing about the spot change is you can actually then just expose the bad skin to the laser and not all the good skin, which is a problem with some IPLs. IPLs are great, but they oftentimes expose the good and the bad skin to the same energy.
On the other hand, what's very nice is you can then switch to the big spot, paint the entire face. As Mary has said, you want that canvas to look even, and even smooth skin that's all one color looks so much younger than splotchy skin. I think Mary understands it better than anybody as a true skincare expert. Mary, tell us about leg veins. What's your approach to leg veins, and where does the XLV Plus fit in?
Well, it's no secret that I'm a big sclerotherapy girl. So I use this device in patients who absolutely refuse to have a needle. But I would be lying if I said that this is my go-to device for leg veins. But what's great about this machine is the versatility of the platform, because you have the 532 that you can use for red and brown, and Omar expounded on the benefits of the 16 millimeter spot size, and Vic talked a lot about the cooling and the little small pen size. And so the versatility of the sizes is crucial, because you can do signature treatments, individualize them for your patients. But the other thing is the laser genesis, and I use that quite a bit in my practice, and I use it for my millennial population. They love the fact that there is no pain, and they get clinical improvement in a little bit in their redness, a little bit in their brown, a little bit in their pores, and active acne will often be improved. So it is one of the devices in my practice that is a millennial device. They absolutely love it. And then the 1064, we actually use the 1064 a lot more for periorbital veins outside the orbital rim than we do for leg veins.
Mary, thanks. We'll get back to the periorbital veins in a minute. Let's close this segment just to talk a bit more about leg veins. So, Mary, you see a patient, you do sclerotherapy, you have a few small vessels left. You sometimes then go back?
Yes, then that would be the best in my practice. For the very tiny, sort of matted ones, that's the best option for this device. It would not be my primary debulker, or, to get it, with one treatment, diminish it by about 80%. But then to fine tune it and to finesse the final result, I think it's a great option.
Mary, that's exactly my approach. Omar, how about you?
Yeah, 100%. I think having the XLV actually makes me better at sclerotherapy because, as you said, Jeff, there are going to be vessels that you can't cannulate with a small gauge needle, and then having the 532 if they're superficial, or the 1064 to go over and trace it, helps you get that better result with your injectional sclerotherapy.
Yeah, I would agree. I really use the XLV for leg veins in isolated phenomena, or very specialized places. The ankles, where people have these matted telangiectasias around the ankles, it works extraordinarily well. It is painful, and you have to get people through the pain. We usually use the air cooler in addition to the built-in cooler for pain, or a cold roller. And then we use it for matting sometimes. In essential telangiectasia, the lower legs, it works really well there. But I agree with Mary that sclerotherapy is the first approach for most leg veins.
It certainly sounds like the Excel V Plus may be a key tool for getting a leg up on patient care. Pun intended. Be sure to listen to additional episodes in the Cutera Experts Corner series, where the panelists discuss more about the specifics of the Excel V Plus technology, as well as other uses for the laser. To learn more about Excel V Plus, visit Cutera.com.